the status of Iowa's effort to stabilize our individual health care insurance market, which has been collapsing because of Obamacare. As I've said for years, Obamacare is unaffordable, unsustainable, and unworkable. Many Iowans get their health insurance through their employer, Medicaid, or Medicare, and the rest purchase health insurance through individual health insurance market. Farmers and small business owners and early retirees rely on purchasing health insurance in the individual insurance market. Before Obamacare, Iowa had a low number of uninsured. Individual health insurance market was robust, and we had some of the lowest premiums in the country. Since Obamacare went into place, we've seen premiums skyrocket. Over the last 4 years, we've seen premiums increase by 110%. Obamacare has driven out consumer choice and competition, as we've seen 8 of 9 health carriers exited Iowa's individual health insurance market. In May, we were facing the prospect of having no individual health insurance market, as every carrier had either announced or indicated that they would be pulling out of the Obamacare individual insurance market. With 72,000 Iowans facing no option to buy health insurance for 2018, I, at that point, asked Commissioner Oman to come up with a short-term solution. In partnership with the local health plan, Commissioner Oman developed the Iowa stopgap measure. The stopgap measure would keep health insurance premiums lower, cover more Iowans, and stabilize the individual health insurance market for, again, the short term. This was always a short-term solution. In order to implement the stopgap measure, we had to receive federal approval from several federal agencies, including the Department of Health and Human Services, as well as the Department of Treasury. The process to receive federal approval is called the Section 1332 State Innovation Waiver. The rules for receiving a 1332 waiver from the federal government, they were developed by Obamacare. Obamacare gives states very little flexibility for innovation in a 1332 waiver. And as I indicated, the stopgap measure was a short-term solution. We have always said from the very beginning that as a long-term solution, we needed Congress to repeal and replace Obamacare. When we began this process, we were optimistic that Congress would act to repeal and replace Obamacare with something that was more affordable and workable. Unfortunately, as you're aware of, Congress has not acted, and Obamacare is still in place and unworkable. So I want to thank President Trump and his administration, and especially I want to thank the Centers for Medicare and Medicaid Services Administrator Seema Verma. Administrator Verma has worked with Iowa to the greatest extent possible, but unfortunately, Obamacare is an unworkable law. Congress must repeal Obamacare, returning power back to the states so states like Iowa can implement innovative solutions that fit their needs. Congress must replace Obamacare with healthcare reform that is affordable for everyday Iowans and empowers consumers to have high-quality health care. And I'm now going to turn it over to Iowa's Insurance Commissioner, Doug Oman, to tell you a little bit more. Doug?
Governor Reynolds, thank you very much. Today, Iowa is formally withdrawing the Iowa stopgap measure, which is formally known as a 1332 waiver from federal consideration. Obamacare does give states very little flexibility, certainly flexibility to innovate, which is what is required here. But I do want to thank the president and his administration for its commitment to state flexibility. Unfortunately, the Affordable Care Act is an unworkable law. In May, we were facing the prospect of having no carriers in our state. We were facing the prospect of every carrier having announced or expressing their intention to leave our state, pulling out of our individual insurance market. With 72,000 Iowans facing no options for healthcare coverage, the Governor Reynolds did ask me to come up with a short-term solution. And so with the help of Wellmark, we developed a plan which we described as the Iowa stopgap measure. It was an innovative solution that was designed to reduce some of the regulatory requirements and also restructure premiums so that it would attract healthy and young individuals back into our market or keep them in our market. It was an innovative effort that was designed to take advantage of what we perceived to be flexibility under the law. But we were doing something that no state had tried to do. After we filed our request for emergency waiver, Medica did announce that at the last minute of the rate filing deadline, its intent to write in our state. It indicated that it would participate in the Obamacare market as a monopoly, but that it filed very, very high new premium rate increases. So at that point in time, we weren't in the same situation that we were at the time we had proposed the stopgap measure, but we continued to pursue it because of the skyrocketing rates that we saw and because of the concern that we had for so many of the Iowans that we would be seeing driven from our market. Individuals that were hardworking Iowans, certainly looking for coverage. We believe that the Iowa stopgap measure was better than Obamacare because it lowered premiums, therefore keeping healthy individuals in the market. In fact, during our public hearings that we held during the process of the waiver, it was literally widely supported and supported by many, many Iowans who were hoping that we would be able to obtain approval. Since we submitted the Iowa stopgap measure 2 months ago, our staff here at the state have worked tirelessly and constantly with federal authorities in order to answer their questions and also to move it forward through adjustments that were being asked of us. But at the same time as we were doing that, what we discovered is the costs continued to climb and increase because we were trying to fit within the unworkable and inflexible requirements under the ACA. As we tried to make these adjustments, we were forced to propose plans that were becoming more expensive and a lot less like state innovation and a lot more like the unworkable Obamacare system that we operate under. Then late last week, we learned from a Department of Treasury staffer that they were several weeks away from calculating how much Iowa would receive in support to support the stopgap measure. Despite what we face with Obamacare and Obamacare rates, Iowa cannot continue to negotiate Obamacare guidelines and await cost calculations. We begin enrollment on November the 1st. Ultimately, the 1332 waiver has proven itself to be unworkable. The ACA's 1332 section says that states can file for innovative waiver, but it was crafted actually to be very inflexible. The ACA has caused our market here in Iowa to collapse, and unfortunately now its inflexibility is preventing us from picking ourselves up and making the adjustments that are needed in order to attract healthy people back in. 48% of the counties in America now have an ACA monopoly market. The market can only be restored if states facing failing markets are given the ability to stabilize their market through flexibility and bring consumers back in. The 1332 waiver was not designed to permit that flexibility. Yet, without flexibility, the waiver will not work and the market will collapse. In other words, Section 1332, which is titled State Innovation Waiver, is in direct contradiction of its own statutory terms. The Iowa stopgap measure was still designed to be an innovative approach, threading the needle in an otherwise structurally and deeply flawed Obamacare system, using market principles to attract healthy individuals back into a market to save our market. It was not perfect. Unfortunately, it now appears that Obamacare's waiver rules are as inflexible as the law itself and cannot be approved under the terms that would be workable for Iowa. The very fact that Congress now, only 9 days from open enrollment, is considering a bill in the Alexander Murray bill to correct some of the defects in 1332 waiver indicates the problems with this provision and the problems that we have faced during our waiver request. I hope that Congress does fix this problem, not just for Iowans, but for all Americans, because at this point, only Congress can. Obamacare is too inflexible, it's too unworkable. One size does not fit every state. And Obamacare really is leading to the collapse of our individual health market. Young people before and now middle-class Iowans, farmers and self-employed individuals who are being asked to pay the full amount of these premiums are confronting rates that will drive them from the market. They will take with them the premiums that they otherwise willingly would pay for health coverage. And the first people to leave are the healthy individuals. Nationally, more than 5 million Americans are likely to do the same. They will begin fleeing our markets when confronted with these skyrocketing rates. These are the Americans that have been mandated to pay 30%, 43%, and 50% rate increases. When we have described the Iowa stopgap measure, we repeatedly explained the rate cliff for the middle class that highlights the unworkability of the ACA. The rigidity of the ACA's 1332 waiver provisions has been difficult to address even this obvious defect. Any changes that Congress makes may have come too late for the 2018 stopgap approval. Open enrollment does begin next Wednesday, so we need to move forward giving Iowans certainty, the certainty that is available to them. So today, Iowa will be withdrawing its waiver. Medica will be selling policies in all 99 counties in our state. And so we will be working with them to ensure that Iowans are aware of this and are able to access the coverage that is available. Governor, I want to thank you so much for your leadership on this issue. Thank you.
We'll open up for questions. Well, I'm extremely disappointed. You know, when we started this process, we had no carriers in the individual market and it had collapsed. And so we're trying to put together a system that doesn't really address a collapsing market. And I am just so proud of the team and Wellmark coming together, putting forward a stopgap proposal. And it was under an emergency waiver, which we've later found out, you know, somewhat doesn't exist, but there was not another state out there that was facing what we were doing. And so what we were facing. And so we had to try to come up with a solution to move forward. But as I've said, at every time I've talked about the stopgap proposal, this is a short-term solution. We need Congress to repeal and replace. Iowa is the first state of many that are going to be facing the very similar situation that we are. And they need to do something to give states more flexibility and to understand the fact that one size fits all is not the answer. We had a robust market. We had low premiums. We had a great individual healthcare market. And then they came in with a one size fits all ACA, Obamacare, and it tanked an individual market that was robust with low premiums and that had a high coverage rate. Well, we do. So here's the other thing. Well, they have Medica. So here's the thing. If we get the waiver approved, then that means we no longer have the individual market. And while Treasury couldn't get us the numbers in a timely manner because the market is collapsing and they're trying to operate within the law, the constraints of the 1332, we do have Medica as a fallback that will provide coverage in all 99 counties. But what we continue to see with Obamacare is skyrocketing premiums, and people can't afford that. So we still need Congress to act. We need them to do what they said they were going to do, and we need them to repeal and replace and give some flexibility back to the states.
Last week when you learned about this Treasury delay on the decision and today, was there something else that happened?
Well, that was late Friday. So, I mean, we just got it until then, Kay. When I say we're working round the clock, we've been working round the clock. We've been working with SEMA. Not only are we working with HHS, we're working with the Department of Treasury, bureaucracy at its best. And so, we're trying to maneuver two different agencies. We're trying to understand what that figure. Doug, step in at any point if I'm misrepresenting something, okay? We're trying to understand what the numbers are to see if we can even get that in a timely manner so we can move forward. In the meantime, the enrollment date is November 1st, and I have to at some point make a decision to start to give some stability to Iowans so they know how they can move forward.
So were you not, the Trump administration hadn't reached a decision to accept or reject yet? You're just saying they were not giving you the numbers?
No, I mean, it's based on the 30. Yeah, you're going to have to pull in here.
That's why you're withdrawing. I guess that's
The challenge is in a collapsing market, when the market is losing healthy individuals in very, very large numbers, we are then being asked under the waiver provisions to pick a place on the graph as the market is collapsing and say that's the amount of money available under what's called pass-through. We have to use that number then to do the calculation to determine how can we restructure it to make it available to attract people back in. So you can see how it doesn't work. In other words, if we were in a steady market, it might make some sense. It makes no sense when you're losing healthy individuals out of your market, and your fix is to attract healthy people back in who may need some income subsidy under the current system. So if we can't change the benefit structure, then we have to at least have some ability to attract individuals back in, because you can't have a market without healthy people.
Commissioner, do you feel like the Trump administration gave this some bigger consideration?
I do. We've been working very closely. Again, things happen at different levels. What I mean by that is the work that I do has been with the individuals within CMS and within Treasury. And so the answer to that question is, I believe that we had full consideration. I just have concluded that the law is unworkable.
That's the problem. I mean, they're going to operate within the law. I talked to Seema Verma this morning, and she reiterated to me her disappointment that we couldn't get this done in a timely manner. I talked to her about the executive order with the short-term insurance as possibly something, if we can get some expedited rulemaking done, that'll could potentially be something moving forward. But the bottom line is, so we're going to continue to talk to our congressional delegation has voted in favor of it. So they've done the right thing. They did what they said they were going to do, but to continue to push Congress to get something done with an unworkable, unsustainable, and unaffordable Obamacare.
I talked to a gentleman who, he and his wife, they're a retired couple in Amy. They have a lake house in Wisconsin. They are literally moving on Wednesday because they had to establish residency in Wisconsin for 60 days in order for the wife to be eligible health insurance there as of January 1st because of this whole debacle. So
yep.
I'm hearing those stories.
I've been hearing them for 3 years.
Yeah.
We've been saying this since this went into effect. As I travel the state over and over and over, I hear from businesses, I hear from hardworking Iowans, I hear from families who have seen their premium skyrocket, their deductibles skyrocket, businesses that don't know how they can continue to provide health care for their employees because of the restrictions that's been placed on them, the mandates, the regulatory environment that they have to operate in. I mean, I'm not just up here saying it's unworkable, unsustainable, and unaffordable on a whim. I hear stories every single day from Iowans just like that one. And that's why we've been just beating the drum for them to get something done. But when we set out and we had the last carrier threaten to pull out, I had to try to do something. And so we came together and we put together an innovative and creative idea. It is a great model. It would have covered more Iowans. It would have brought premiums down, still not where they need to be, but it was certainly a better option to what we had because we were bringing income and age. We were taking that into account and not just based on income. So we needed the flexibility as the first state in the nation to see their individual market completely collapse and all the carriers pull out. But what's happened is the 1332 waiver said, here, governors, go be innovative as long as it looks and acts just like Obamacare. That's what it did. And believe me, we can't fix a collapsing market when it looks and acts just like Obamacare.
Commissioner, in a nutshell, what's the difference between this fund and the ones that have been?
That's what the governor just said is the reason. What is happening for some of the states that have looked at trying to do some change in terms of Obamacare, it's essentially been adding a reinsurance, but not changing anything else about the plans. And the reality is that doesn't change the structural defects. It may prolong the process, but it's not going to change anything. And so that's why Congress needs to do its job and fix this law. We are facing a circumstance, not just here in Iowa, because I have been to the commissioner conferences and I know what's happening. 40% of our country, 40% of the counties now are a monopoly carrier. I'm sorry, but a monopoly carrier funded by the federal government is no longer a market. A system that actually encourages carriers to file skyrocketing rates and encourages regulators to approve those rates, knowing that it's only funded because of the federal government tax credit subsidies, is not a market. I believe that in our market this coming year, in our ACA individual market, 80% of the premium flowing in to the medical company will be federal dollars. That is no longer a working market, and Iowa is not alone in that circumstance. This is a national problem, and Congress needs to fix it.
Do you have any idea how many people will drop out of the market here? I think we've been working with a 72,000 number, but I think I saw maybe some documents you filed that you anticipated if we stayed with Obamacare, you would see a number of people drop out. I think it was in the tens of thousands.
It is. It's really hard to predict consumer behavior, but our actuaries have concluded that it'll be between 18 to 22,000 Iowans will leave the market. Now, again, the healthiest are the first to go. Those are the people that contribute to a health insurance system who actually don't have reasonably low claims. So what it ends up doing is we call that death spiral or adverse selection, but it kills the market. And that's what we're seeing here. Again, I'm telling you that there are states all across the country that are facing the very same problem. What we tried to do was stop it from happening.
Governor, the commissioner just said this is a national problem. Congress needs to fix it. Until Congress does, do you plan some sort of state level tax break or something for these 72,000 people to help them with their insurance policies? A proposal of the state?
Well, again, we don't know what that looks like. And so I can't put a dollar amount on that. So we're looking at any and every option that we can, Kay. I know there's been other suggestions that have been made. I talked to SEMA about that this morning. They would require a waiver process. So it's just not as easy as bringing them onto the state policy or bringing them into the Medicaid. You still have to go through a waiver process. Then you have two individual markets and then they conflict with each other. So, I mean, it's not a simple fix. And as I mentioned, I talked to SEMA about the executive order with short-term insurance. If, so I'm advocating for that. If we can get some expedited rulemaking for that potentially could hit the right timing, but I don't know. So I'm going to be out in DC tomorrow and I'm meeting with the congressional delegation. We're going to talk to them. The Alexander Murray is another bill that's out there, but time-wise, that wasn't going to get done in a timely manner that we thought would address, what we're looking at with the inflexibility of the 1332 waiver. So every day we're trying to see what our options are as we move forward. But I don't think I can say this enough. The bottom line is we need Congress to do their job and we need them to act, and they need to act sooner rather than later.
Have you talked to the president about this?
Yeah, I did. That was part of the phone call that I had with him last week. It was renewable fuel and it was the stopgap. But I did tell him thank you for helping because he really has empowered Administrator Verma to work with our team to try to get something done. It came down to the law, and it's as it's written. It just does not afford the flexibility that we need to be creative. And that's the beauty as you look at the different states and they look at the population that they have to serve and who we're trying to help provide some sort of coverage for. All states are different. And so there has to be parameters. I get that. But we also need to have the flexibility to meet the needs of Iowans.
Can we, would be fair, Kate just asked you, is there any way that you can step up with some kind of state assistance? Can we say you said we're looking at every option. So can we say you haven't ruled that out?
Well,
Some kind of state tax break or something?
Well, what I'm saying is I'm not, listen, every day we're all trying to figure out what we can do in the short term to get some type of coverage for Iowans that they can afford. And so there's a lot of different areas that we're looking at. The problem, the biggest problem is it's collapsing. And as the commissioner said, the numbers are just varying. So it's hard for us to predict and have some sense of what we're looking at. But we're going to continue to fight for Iowans and see what we can come up with.
Two more questions. Commissioner, if the Alexander Murray bill doesn't pass, which includes the subsidies for insurance companies, do you know what Medicaid's rates in Iowa would be?
Yeah, the issue surrounding the cost sharing reductions, they have some impact here in Iowa on the individuals that don't receive the subsidies. But that is, when you say, do I know? The answer is yes, I do know. By actually funding those, it would have some decrease in cost for those that are in the unsubsidized part of the market. But you need to understand that the rates are already so high. It moved, Medica originally filed a 43% increase. For a lot of Iowans, that's already essentially a doubling of what they're paying in 2017. So it still will price out thousands of people. Where it doesn't have any impact, which has now become confusing, is that it really has very little impact on the individuals that are actually the recipients of those cost sharing reductions. So you can just tell Congress has continued to struggle with some of these complicated issues, and really they need to give flexibility to the states because we are able to evaluate our market and provide the subsidy support where it needs to be in order to attract healthy people into the market.
Last question.
Are you just meeting with congressional delegation, or are you trying to meet with anybody?
Tomorrow, I'm meeting with Vice President Pence. I'm meeting with Administrator Pruitt. I'm meeting with our congressional delegation, and I'm meeting with Trade Representative. So I'm doing a Million Women Mentor event. Well, so what am I going to keep asking for? Congress to repeal and replace. I'm going to talk about what we went through. I'm going to make sure he understands the inflexibility, which they do, but to just kind of walk through the impact that has on Iowa, talk about the short-term insurance and working to get expedited rulemaking, just to make sure there's not anything that we haven't overlooked. And so it's kind of just an opportunity to sit down with the congressional delegation and talk about what other alternatives we have moving forward.
Also with